Ever try that thing where you
Ah,
just, take a moment to appreciate everything you've got before, diving into a study session?
yeah,
It's like a mental warm-up, you know?
right.
And speaking of brain boosting, we're about to tackle
Yeah.
the Texas Pharmacy Rules,
Mm,
the essential guide for anyone gearing up for the MPJE.
yeah.
Think of it as our legal playbook for navigating pharmacy practice in the Lone Star State.
Yeah. It's not just a dry read, though. I mean, this document really lays the groundwork for, everything you'll do as a pharmacist in Texas.
Right. And trust me, we're not just skimming the surface here.
Yeah.
We're going deep, unpacking the key regulations
Mhm.
and connecting them to, real-life pharmacy practice.
Yeah. And that's what's so crucial. These rules aren't just abstract concepts, they're the foundation for ensuring patient safety, maintaining professional standards, and
Yeah.
navigating the complex world of medication dispensing.
So first things first, let's decode the different classes of pharmacies in Texas. You've got your Class A, your Class C, even a Class E. Talk about alphabet soup. Why does Texas have all these different classifications?
Well, it's all about recognizing that different pharmacy settings have unique needs and require, tailored regulations. A Class A pharmacy, your typical community pharmacy, operates quite differently from a Class C institutional pharmacy within a hospital, for example.
Okay, that makes sense. So imagine you've aced pharmacy school, you're ready to hang up your shingle. What's next?
Well, before you can even think about dispensing your first prescription, you need to obtain a pharmacy license in Texas. And it's not just about passing an exam, there's a whole process involved, including background checks, disclosures, and demonstrating that you meet all the qualifications.
Sounds rigorous. I bet maintaining that license is no walk in the park either.
You're absolutely right. Maintaining your license means staying in good standing with the Texas State Board of Pharmacy. This includes things like disclosing any criminal convictions, reporting any disciplinary actions, and fulfilling those continuing education requirements to stay up to date with the latest practices and regulations.
It's a commitment to lifelong learning, right? Always striving to be the best pharmacist you can be.
Exactly. And speaking of roles, let's talk about the pharmacist in charge. This person is essentially the captain of the pharmacy ship, responsible for ensuring everyone on board is following the rules and maintaining the highest standards of practice.
So they're not just filling prescriptions, they're leading the team, setting the tone, and making sure everything runs smoothly and safely.
Precisely. And let's not forget about the pharmacy technicians. They play a crucial role in assisting pharmacists, but the rules are very clear about what tasks they can and cannot perform. It's all about defining those boundaries, ensuring patient safety, and making sure everyone operates within their scope of practice.
Speaking of boundaries, let's dive into the heart of pharmacy practice prescriptions. Those little slips of paper or increasingly electronic files are like the keys to the pharmacy kingdom. What are some must-know facts about prescriptions in Texas for the MPJE?
Well, first and foremost, a valid prescription in Texas must contain some key elements. Think patient name, drug name and strength, dosage form, quantity, directions for use, and of course, the prescriber's information, including their signature. It seems basic, but every detail is crucial for patient safety and legal compliance.
It's like a recipe, right? You need all the right ingredients in the right amounts to create the intended outcome.
Exactly. And just like a recipe can have variations, there are nuances to prescriptions as well. The rules outline specific requirements for new prescriptions versus refills, electronic prescriptions versus written ones, and even prescriptions issued by practitioners in Canada and Mexico.
Wow, prescriptions from other countries. That's interesting. Okay, so we've got our valid prescription. What happens next?
Well, that's where the pharmacist's expertise really comes into play. Dispensing a medication isn't simply about handing over a bottle of pills. It involves a thorough review of the prescription, checking for potential issues like drug interactions, allergies, or inappropriate dosages.
So it's about being that final checkpoint, that safety net for the patient, ensuring the prescribed medication is appropriate and safe for them.
Precisely. And beyond that initial review, Texas law emphasizes the importance of patient counseling. Pharmacists are required to provide clear instructions on how to take the medication, address any concerns the patient might have, and ensure they understand potential side effects or interactions.
It's about empowering patients to take an active role in their own healthcare, right? Making sure they feel informed and comfortable with their medication regimen.
Exactly. It's about building trust, establishing that pharmacist-patient relationship, and ultimately ensuring the best possible outcomes for the patient.
Now, let's shift gears and talk about a topic that always seems to come up on the MPJE, controlled substances. These are medications with a higher potential for abuse or dependence. So naturally, the regulations surrounding them are a bit more strict.
You're absolutely right. Texas law has specific requirements for dispensing controlled substances, particularly those classified as Schedule II drugs, which have the highest potential for abuse. Think strong painkillers or medications used to treat ADHD.
Okay, so what are some key things to remember about Schedule II drugs in Texas?
Well, for starters, they require an official prescription form, which is designed to prevent forgery or alteration. There are also stricter limits on refills. And pharmacists are required to maintain meticulous records, tracking every single dose that enters and leaves the pharmacy. It's all about accountability and preventing diversion.
It's like a forensic investigation for medications. Every pill, every milliliter has to be accounted for. Makes sense, given the potential for abuse.
Exactly. And it's not just about dispensing. Texas law also outlines specific procedures for ordering, storing, and securing controlled substances, all aimed at minimizing the risk of theft or misuse.
So it's a comprehensive approach, really, encompassing every aspect of handling these sensitive medications.
Precisely. And it's an area where pharmacists play a crucial role in safeguarding public health.
Now let's talk about another important aspect of pharmacy practice: record keeping. It might not be the most glamorous part of the job, but it's absolutely essential for ensuring compliance and accountability.
You're right. Texas law mandates meticulous documentation of nearly every aspect of pharmacy operations. Think prescription logs, controlled substance inventories, dispensing records, patient profiles, compounding logs. The list goes on.
It sounds like a mountain of paperwork. Why is record keeping so important in pharmacy practice?
Well, for several reasons. First and foremost, it demonstrates compliance with all those regulations we've been discussing. These records are like proof that the pharmacy is operating according to the law, ensuring patient safety and maintaining professional standards.
Okay, so it's like an audit trail showing that everything is being done by the book.
Exactly. And beyond compliance, these records can be invaluable in other situations. Think about a lawsuit, an investigation, or even a simple question from a patient.
It's like the pharmacy's memory bank, providing a detailed history of everything that's happened.
Precisely. And that can be crucial for resolving disputes, answering questions, and even identifying potential problems before they escalate.
So maintaining accurate and organized records is more than just a chore. It's a fundamental aspect of responsible pharmacy practice.
Absolutely. It's about accountability, transparency, and ultimately protecting both patients and the pharmacy itself.
Now, let's switch gears and talk about compounding, which is essentially the art and science of preparing customized medications to meet a patient's specific needs. It's like pharmacy meets chemistry lab.
It is. And just like any lab, there are strict protocols and regulations in place to ensure safety and quality control.
So what are some key things to remember about compounding in Texas?
Well, the rules differentiate between non-sterile compounding, think topical creams or oral solutions, and sterile compounding, which involves preparing medications for injection. Sterile compounding has even stricter requirements, given the heightened risk of contamination.
It's all about maintaining a pristine environment, right?
Right.
Using aseptic techniques and following those standard operating procedures to the letter.
Precisely. And documentation is key here as well. Every step of the compounding process must be carefully documented, from the ingredients used to the equipment sterilized to the final product labeling.
It's like a chain of custody for medications, ensuring traceability and accountability every step of the way.
Exactly. And beyond the technical aspects, Texas law also emphasizes the importance of training and qualifications for anyone involved in compounding. Pharmacists and technicians must demonstrate competency in the specific techniques and procedures involved.
It makes sense given the level of precision and expertise required for compounding.
Absolutely. It's an area where attention to detail, meticulousness, and adherence to protocols are paramount.
Now let's talk about a topic that's been in the news a lot lately: opioid antagonists. These medications, like naloxone, can literally reverse the effects of an opioid overdose and save lives.
You're right. And thankfully, Texas law recognizes the urgency of the opioid crisis and has specific provisions related to dispensing these life-saving medications.
So what are some key things pharmacists need to know about dispensing opioid antagonists?
Well, in some cases, pharmacists are allowed to dispense these medications without a prescription, directly to individuals at risk of an overdose or their family members or friends. It's about removing barriers to access, recognizing that in these situations, every second counts.
That's incredible. So pharmacists can literally save lives by dispensing these medications,
Yeah.
even without a traditional prescription from a doctor.
Exactly. And the law also protects pharmacists from liability when dispensing these medications in good faith, even without a prescription.
It's a powerful example of how pharmacy law can adapt to address pressing public health challenges, empowering pharmacists to use their knowledge and judgment to make a real difference.
Absolutely. It's about recognizing the unique role pharmacists play in healthcare and equipping them with the tools and authority to save lives.
Okay, we've covered a lot of ground so far, but before we dive into more complex topics, let's do a quick knowledge check
Yeah.
to solidify what we've learned about Texas pharmacy law. Think of this as your MPJE prep in action.
Sounds like a plan. I've got some multiple choice questions ready to put your knowledge to the test.
Bring it on. Let's see what I've retained.
All right, here's your first question. A pharmacy technician in Texas wants to help out with inventory management. Which of the following tasks can they legally perform under the supervision of a pharmacist?
Okay.
A, verifying the receipt of controlled substances and updating the inventory log. B, ordering Schedule II medications from a wholesaler using the pharmacy's DEA number.
Okay.
C, disposing of expired controlled substances without the pharmacist's supervision.
Right.
D, accepting a delivery of medications without verifying the contents against the invoice.
This is a great example of how the MPJE tests not just your knowledge of the rules, but also your understanding of their practical application.
Right.
What do you think? So the answer must be A.
You got it. Pharmacy technicians can assist with inventory management tasks, including verifying receipts and updating logs, but only under the direct supervision of a licensed pharmacist. The other options would be considered violations of the law and could put the technician and the pharmacy at risk.
Yeah, that's a good reminder that even seemingly simple tasks have legal implications and require careful adherence to the rules. What's the next question?
Okay, let's test your knowledge on dispensing. A pharmacist receives a prescription for a Schedule II controlled substance. The prescription is written on a plain piece of paper and brought in by the patient's spouse. What should the pharmacist do? A, dispense the medication since the patient's spouse brought in the prescription.
Okay.
B, verify the prescription with the prescriber and then dispense the medication.
Right.
C, refuse to dispense the medication because it's not on an official prescription form.
Okay.
D, dispense a partial quantity of the medication and advise the patient to obtain a new prescription for the remaining amount.
I remember we talked about special requirements for Schedule II drugs.
Yeah,
So the answer must be C.
that's absolutely correct. Schedule II medications in Texas require an official prescription form to prevent forgery and ensure proper documentation. Dispensing a controlled substance without a valid prescription or on an unofficial form is a serious violation.
It seems obvious, but I imagine under pressure, it's easy to overlook those critical details. These quizzes are really helping to reinforce those key points.
Absolutely. They're designed to, make you think critically and apply the rules to real-world scenarios, just like you'll do as a licensed pharmacist. Ready for another challenge?
Absolutely. Hit me with your best shot.
All right, here's a question that dives into the ethics of pharmacy practice. A pharmacist discovers that a colleague has been diverting controlled substances for personal use. What is their ethical and legal obligation in this situation? A, confront the colleague and encourage them to seek help.
Okay.
B, ignore the situation to avoid potential conflict or retaliation.
Oh, wow. Okay.
C, report the suspected diversion to the Texas State Board of Pharmacy.
Okay.
D, document the suspected diversion, but take no further action.
This is the tough one. Well, we talked about the importance of reporting misconduct to protect patients and the profession.
Right.
So the answer is C.
You nailed it. While it can be uncomfortable to report a colleague, pharmacists have a legal and ethical duty to report any suspected violations of the law or professional standards to the Texas State Board of Pharmacy. It's about putting patient safety and the integrity of the profession above personal relationships or fears of reprisal.
It's a powerful reminder that we're all accountable for upholding the highest standards of practice. And sometimes that means making difficult decisions. What other MPJE essentials should we cover?
Let's talk about a topic that's often tested. The beyond use date for compounded medications. Remember, this is the date after which a compounded preparation should no longer be used.
Right. It's all about maintaining the stability and potency of those customized medications over time. But the rules can be tricky, especially when it comes to different types of preparations.
Yeah, you're right. It's important to distinguish between sterile and non-sterile compounded medications. For non-sterile preparations like topical creams or oral solutions, the general rule is that the beyond use date should not exceed 1 year from the date the preparation was compounded, unless stated otherwise by the manufacturer.
That's a good rule of thumb to remember. But what about sterile preparations? Those are medications intended for injection, so I imagine the rules are even stricter.
Absolutely. For sterile preparations, the beyond use date is determined by various factors, including the specific ingredients, the sterility testing performed, and the storage conditions. The Texas Pharmacy Rules outline specific beyond use date guidelines for different categories of sterile preparations.
So it's not a one-size-fits-all approach.
Right.
Pharmacists need to carefully consider those factors and follow the specific guidelines to ensure the safety and efficacy of those sterile medications.
Exactly. And it's an area where pharmacists play a critical role in safeguarding patient well-being. Now, let's shift gears and talk about another rapidly evolving area of pharmacy practice: remote pharmacy services.
It's like bringing the pharmacy to the patient, virtually or otherwise. And as you can imagine, there are specific rules governing these types of services, all aimed at ensuring patient safety, security, and maintaining the same high standards of practice as traditional brick-and-mortar pharmacies.
Absolutely. Let's start with telepharmacy, which allows pharmacists to connect with patients remotely for consultations, medication reviews, or even counseling on new prescriptions. Think about the potential for expanding access to care in rural or underserved areas where patients might not have easy access to a local pharmacy.
It's like virtual healthcare for medications. But with those virtual interactions come new challenges, like ensuring patient privacy, verifying identities, and maintaining the security of sensitive information.
Exactly. And the Texas Pharmacy Rules address those challenges head-on. They require secure communication platforms, strict protocols for patient identification and verification, and clear guidelines for pharmacist-patient interaction in the virtual realm.
It's about ensuring that those virtual encounters are just as safe, effective, and professional as in-person interactions. What about automated dispensing systems? Those are becoming increasingly common in hospitals and other healthcare settings.
You're right. Automated dispensing systems can streamline medication management, reduce the risk of errors, and improve efficiency. But they also introduce new complexities and potential risks that require careful oversight and regulation.
So what are some key things to remember about these systems in Texas?
Well, the rules require pharmacies to have specific policies and procedures in place for using automated dispensing systems, including strict security measures to prevent unauthorized access, regular maintenance and testing to ensure accuracy and reliability, and comprehensive training for all personnel who will be operating or interacting with the system.
It's about recognizing that while these systems can be incredibly helpful, they're not foolproof and require careful planning and oversight to ensure they're being used safely and responsibly.
Exactly. And let's not forget about central fill pharmacies, which are essentially centralized hubs that can fill prescriptions for multiple pharmacies within a chain or network. This can be a great way to improve efficiency and reduce costs, but it also introduces new challenges in terms of coordination, communication, and maintaining proper record keeping.
So how does Texas law address those challenges?
The rules outline specific requirements for central fill pharmacies, including clear protocols for transmitting prescription information, verifying patient identities, labeling medications accurately, and ensuring timely delivery to the dispensing pharmacy.
It's about maintaining that chain of custody, ensuring accountability every step of the way, and ultimately, ensuring the patient receives the correct medication safely and efficiently. Speaking of efficiency, continuing education is essential for staying up to date with all those evolving regulations and best practices in pharmacy.
Absolutely. Texas requires pharmacists to complete a certain number of continuing education hours each year to maintain their license, focusing on topics relevant to pharmacy practice and patient care.
So it's not just about checking boxes. It's about embracing lifelong learning and staying informed about new medications, therapies, guidelines, and of course, those ever-changing regulations.
Exactly. And the Texas State Board of Pharmacy has specific requirements for what types of continuing education programs qualify, ensuring they meet certain standards and address relevant topics.
It's about maintaining competence, expanding your knowledge base, and ultimately providing the best possible care for your patients. Speaking of patient care, let's circle back to the Code of Conduct and its implications for ethical decision-making in pharmacy practice. We touched on reporting misconduct earlier, but what are some other key takeaways for aspiring pharmacists preparing for the MPJE?
Well, the Code of Conduct serves as a framework for ethical decision-making, encompassing a wide range of principles and responsibilities that go beyond simply following the letter of the law. It emphasizes things like patient confidentiality, maintaining professional boundaries, avoiding conflicts of interest, and always acting with honesty and integrity.
It's like a moral compass for pharmacists, guiding their decisions and actions in all aspects of their professional lives.
Precisely. And the MPJE often includes questions that test your understanding of those ethical principles and how they apply to real-world scenarios.
So it's not just about memorizing rules, it's about internalizing those ethical values and being prepared to apply them in challenging situations. It's about recognizing that being a pharmacist is more than just a job. It's a profession with a deep commitment to patient well-being and public health.
Well said. And that commitment is reflected in everything from how we dispense medications to how we interact with patients to how we advocate for safe and effective medication use.
Speaking of advocacy, let's talk about a topic that's near and dear to my heart: patient counseling. It's one of the most important interactions a pharmacist has with a patient, and the Texas Pharmacy Rules outline specific requirements for what that counseling should entail.
It's not just about handing over a bag of medications and sending the patient on their way. It's about taking the time to explain how to take those medications safely and effectively, answer any questions they might have, and ensure they understand the potential side effects or interactions.
It's about empowering patients to take an active role in their own healthcare, making sure they feel comfortable and informed about their medication regimen.
And the rules specify that this counseling should be offered to both new and existing patients whenever a new prescription is filled or when the patient requests it.
It's about making that information readily available, recognizing that patients might have questions or concerns that arise even after they've started taking medication.
And it's not just a one-way conversation. Pharmacists are expected to actively engage with patients, assess their understanding, and tailor their counseling to meet the patient's individual needs.
So think about things like language barriers, literacy levels, or cultural beliefs that might influence how a patient approaches their medications.
It's about being sensitive to those individual differences and making sure the information is communicated in a way that's clear, understandable, and respectful.
And it's not just about conveying information, it's about building a rapport with the patient, establishing that trusting relationship that's so essential for effective healthcare.
Exactly. And remember, patient counseling isn't just a box to be checked. It's an opportunity to make a real difference in a patient's life, to help them navigate the often complex world of medications and achieve the best possible health outcomes.
Absolutely. Now let's talk about a topic that might not seem directly related to pharmacy law, but is incredibly important in practice: preventing drug diversion and abuse. With the ongoing opioid epidemic, pharmacists have a crucial role to play in ensuring these powerful medications are used safely and responsibly.
You're absolutely right. The Texas Pharmacy Rules, while not solely focused on this issue, provide a framework for pharmacists to identify and address potential red flags that could indicate drug diversion or abuse. Think about things like prescriptions that seem excessive or inappropriate, patients who appear to be doctor shopping, or requests for early refills without a legitimate reason.
So it's about being vigilant, using your professional judgment, and not being afraid to ask questions or even refuse to dispense a medication if you suspect it's not being used for legitimate medical purposes.
Exactly. It's a delicate balance between providing access to necessary medications and preventing those medications from falling into the wrong hands. Pharmacists have a responsibility to both their patients and the community as a whole to ensure these powerful drugs are used safely and appropriately.
It's a challenging but incredibly important aspect of pharmacy practice, and it requires pharmacists to stay informed, be aware of the latest trends in drug diversion and abuse, and use their knowledge and authority to make responsible decisions.
Absolutely. It's about being proactive, recognizing those red flags, and taking appropriate action to protect both patients and the community.
Now, before we wrap up this deep dive, I want to touch on a topic that often gets overlooked, but is crucial for anyone preparing for the MPJE: understanding key definitions. The Texas Pharmacy Rules are written in a very specific language, and knowing those definitions can make all the difference in correctly interpreting and applying the rules.
You're absolutely right. Those definitions might seem like small details, but they're the building blocks for understanding the entire framework of pharmacy law in Texas.
So let's play a little definition game, shall we? I'll give you a term, and you see if you can recall the definition according to the Texas Pharmacy Rules.
Sounds like fun. I'm always up for a challenge.
All right, first up, dispense. What does it mean to dispense a medication in the legal sense?
Okay, let me think. Dispense means to deliver a medication to an ultimate user or their agent, pursuant to a lawful order of a practitioner. It includes all the steps involved in preparing, packaging, labeling, and delivering that medication to the patient.
You're on a roll. It's not just about handing over a bottle of pills. It's about the entire process of getting that medication to the patient, safely and legally.
All right, give me another one.
Okay, how about this one? Drug regimen review. What exactly does that involve?
That's where a pharmacist's clinical expertise really shines. Drug regimen review is the process of evaluating a patient's entire medication therapy to identify and resolve any potential problems, such as drug interactions, allergies, inappropriate dosages, or therapeutic duplications.
That's a mouthful, but you got it. It's about taking that holistic view of the patient's medications, ensuring they're all working together safely and effectively.
It's like being a medication detective, looking for clues that might indicate a problem and then working with the patient and their doctor to find solutions.
Exactly. And that's a key distinction between a pharmacist and a technician, right? Technicians can help with the technical aspects of dispensing, but that drug regimen review requires a pharmacist's clinical judgment and knowledge.
Absolutely. It's a core element of pharmacy practice, and it's what sets pharmacists apart as medication experts.
Okay, last one for this round. Electronic signature. This one is becoming increasingly important in the digital age of pharmacy practice.
Let me see if I can remember this one. An electronic signature is a type of digital identifier that's used to verify the authenticity of electronic prescriptions and other pharmacy-related documents. It must meet certain standards of security and reliability to ensure it's legally valid and can't be easily forged or tampered with.
You're a definition machine.
Yeah.
And that's so important these days with more and more prescriptions being transmitted electronically.
Exactly. It's about maintaining the security and integrity of those digital transactions, ensuring that those electronic prescriptions are just as valid and reliable as their paper counterparts.
And the rules are very specific about the types of electronic signatures that are acceptable, the security measures that need to be in place, and the need for audit trails to track who's accessing and signing these documents.
It's all about creating a secure digital environment for pharmacy practice, protecting patient information, and preventing fraud or misuse.
Absolutely. And, these definitions might seem like small details, but they're the building blocks for understanding the entire framework of pharmacy law in Texas.
It's like learning a new language, right? Once you master the vocabulary, you can start to understand the nuances of the grammar and the structure of the sentences. And in this case, the sentences are the rules that govern pharmacy practice.
And just like learning a new language can open up a whole new world of communication, understanding pharmacy law can empower pharmacists to practice with confidence, knowing they're operating within the boundaries of the law and upholding the highest standards of the profession.
It's about protecting patients, ensuring safe and effective medication use, and fostering trust in the pharmacy profession. Those are goals worth striving for, wouldn't you say?
Absolutely. Now let's shift gears and talk about a topic that's essential for anyone aspiring to be a pharmacist in Texas. The pharmacy technician's role in maintaining compliance with all these regulations. They might not have the same level of authority as pharmacists, but they're critical members of the pharmacy team and have a responsibility to uphold the law and prioritize patient safety.
You're right. Pharmacy technicians are often the unsung heroes of the pharmacy, working behind the scenes to ensure everything runs smoothly. And just like pharmacists, they have a legal and ethical obligation to follow the rules, adhere to procedures, and maintain the highest standards of practice.
So what are some key things technicians need to know about their role in maintaining compliance?
Well, first and foremost, they need to understand the boundaries of their scope of practice. The Texas pharmacy rules outline specific tasks that technicians are allowed to perform under the supervision of a pharmacist, and it's crucial that they stay within those boundaries.
Right. It's about knowing what they can do and, just as importantly, what they can't do. Things like counseling patients or making decisions about medication substitutions are strictly off limits for technicians.
Exactly. And it's not just about protecting patients, it's also about protecting technicians themselves. By clearly defining their scope of practice, the rules help prevent them from being placed in situations where they might feel pressured to perform tasks that are beyond their training or competence.
It's about creating a safe and supportive work environment where everyone understands their roles and responsibilities and feels empowered to speak up if they have concerns.
Absolutely. And, it's not just pharmacists and technicians who play a role in maintaining compliance. The pharmacy owner or manager also has a significant responsibility to ensure the pharmacy is operating according to the law.
Right. They're ultimately accountable for everything that happens in that pharmacy, from hiring qualified personnel to maintaining adequate inventory to creating a safe and secure environment for both staff and patients.
Exactly. And that includes things like having proper security systems in place, maintaining controlled temperatures for medication storage, ensuring the pharmacy is clean and organized, and providing ongoing training for all staff members.
It's about creating a culture of compliance where everyone understands the importance of following the rules and prioritizes patient safety above all else.
Absolutely. Maintaining compliance isn't just about avoiding penalties or fines. It's about creating a work environment where everyone feels empowered to do things the right way and knows that patient well-being is the top priority.
Speaking of priorities, patient safety is a key focus of the Texas Pharmacy Rules, and it's something that every pharmacist should be thinking about in every aspect of their practice. The rules are designed to minimize the risk of errors, but it takes more than just following procedures to create a truly safe environment for patients.
You're absolutely right. It's about fostering a culture of safety in the pharmacy where everyone is vigilant, everyone is accountable, and everyone is comfortable speaking up if they see something that's not right.
So it's about encouraging open communication, reporting errors without fear of retribution, and learning from mistakes to prevent them from happening again.
Exactly. And that includes things like double-checking prescriptions, verifying patient information, and ensuring medications are dispensed accurately and labeled correctly. Every step in the process is an opportunity to catch potential errors before they reach the patient.
It's a team effort, really. From the pharmacists to the technicians to the support staff, everyone plays a role in maintaining a safe and error-free environment.
And the Texas Pharmacy Rules provide a framework for that teamwork, outlining clear responsibilities for each role and ensuring that everyone is working together towards the common goal of patient safety.
Now, before we move on to the final part of our deep dive, let's take a moment to talk about the evolution of pharmacy practice and how the Texas Pharmacy Rules are adapting to those changes. It's a dynamic profession, constantly evolving to meet new challenges and embrace new opportunities.
Absolutely. The rules aren't static. They're constantly being updated to reflect changes in healthcare, technology, and the needs of patients. Think about how the rules have been revised to address the opioid epidemic, the rise of telepharmacy, and the increasing use of electronic prescribing and automated dispensing systems.
It's about staying ahead of the curve, anticipating those changes, and ensuring the rules are always relevant and effective in protecting patients and promoting safe medication practices.
And that's why it's so important for pharmacists to stay informed, to keep up with the latest rule changes and interpretations, and to be adaptable in their practice.
It's about embracing lifelong learning, being curious, and recognizing that pharmacy practice is a dynamic field that requires constant growth and development.
Exactly. And that commitment to staying current is not only essential for passing the MPJE, but it's also crucial for providing the best possible care for your patients throughout your career.
Speaking of the MPJE, I think it's time to shift our focus to the exam itself. We've covered a lot of ground on this deep dive.
Right.
But how does all this knowledge translate into success on the MPJE? What are some key things aspiring pharmacists should keep in mind as they prepare for this crucial exam?
Well, first and foremost, remember that the MPJE is designed to assess your understanding of Texas pharmacy law and how it applies to real-world practice. It's not just about memorizing rules, it's about demonstrating your ability to interpret those rules, apply them to different scenarios, and make, sound judgments based on your knowledge and ethical principles.
So it's about thinking critically, analyzing situations, and showing that you can handle the challenges of being a licensed pharmacist in Texas.
Exactly, and that's why we've been focusing on connecting those rules to real-life situations, providing those practice questions, and emphasizing those ethical considerations.
Right. It's not just about passing a test. It's about preparing you for the real world of pharmacy practice.
Absolutely. Now, in terms of specific tips for the MPJE, I always recommend familiarizing yourself with the exam format and content outline. The Texas State Board of Pharmacy provides a blueprint that outlines the key areas covered on the exam, so make sure you're spending adequate time on each topic.
That makes sense. It's about strategizing your study plan and focusing on those high-yield areas. Are there any specific study resources you recommend?
Of course. The Texas Pharmacy Rules document itself is your primary source of information. Make sure you have a thorough understanding of each section, including the definitions of key terms. There are also various review books and online resources available that can help you consolidate your knowledge and test your understanding with practice questions.
Practice questions are key, right? It's one thing to know the rules in theory, but it's another thing to apply them in those exam-style scenarios.
Absolutely. The more practicing questions you do, the better prepared you'll be for the types of questions you'll encounter on the MPJE. And don't be afraid to reach out to professors, mentors, or even practicing pharmacists for clarification or guidance as you study.
It's about building that support network, tapping into those resources, and recognizing that you don't have to go through this journey alone.
Exactly. Now, another tip for success on the MPJE is to pay attention to recent changes or updates to the Texas Pharmacy Rules. The Board of Pharmacy regularly reviews and revises the rules to reflect changes in healthcare, technology, and best practices.
So it's not enough to just study the rules as they were a year ago. You need to be aware of any recent updates or amendments.
Absolutely. Make sure you're using the most up-to-date version of the Texas Pharmacy Rules document and stay informed about any recent changes or announcements from the Board of Pharmacy.
Okay, so stay current, use those resources, practice those questions. Any other words of wisdom for MPJE success?
Well, beyond the content itself, remember to take care of yourself during the study process. Get enough sleep, eat healthy foods, stay hydrated, and take breaks to clear your head and recharge.
It's about approaching the exam with a clear and focused mind.
Exactly. And on the day of the exam, stay calm, read each question carefully, and trust your knowledge and preparation.
You got this. Well, I think we've covered just about everything in our deep dive into the world of Texas pharmacy law and regulations. We've explored the intricacies of the Texas Pharmacy Rules, tackled challenging practice questions, and even delved into the ethical considerations that guide pharmacy practice.
It's been quite a journey, but I hope you feel empowered, informed, and perhaps even a little bit excited to embark on this rewarding career path.
I know I am. So as you continue on this journey to becoming a licensed pharmacist in Texas, remember this deep dive. Keep those Texas pharmacy rules handy and never stop learning and growing in your profession.
And as you step into the world of pharmacy practice, always remember the patients you serve. Your knowledge, skills, and commitment to ethical practice will make a real difference in their lives.
Absolutely. And to all our listeners out there, thank you for joining us on this deep dive into the world of Texas pharmacy law. If you found this episode helpful, be sure to like, subscribe, and share it with your fellow pharmacy students, colleagues, or anyone who's curious about this fascinating field.
And remember, we're all in this together. Let's support each other, share our knowledge, and strive to provide the best possible care for the patients who rely on us.
Until next time, keep learning, keep growing, and keep diving deep into the ever-evolving world of pharmacy.